Welcome to the News 13 Coronavirus Virtual Town Hall meeting. I'm George Roberts.
And I'm Marie Johns. This week we'll be discussing what is happening with COVID-19 here in our region and how it's being handled at our local hospitals.
Now joining us today on the program, we have Dr. Jonathan Goldner, Associate Chief Medical Officer at Lehigh Valley Hospital-Pocono.
And Dr. William Markson, Medical Director at St. Luke's Hospital, Lehighton campus. Thank you, guys.
Dr. Goldner, let's start with you. I understand yesterday Stephen Abdo of Toby Hanna was released from the hospital after having COVID-19. He was there for about 2 weeks and he was on a ventilator. And I understand that now he got off and he went home yesterday.
Yep, it's true, George. We actually had 2 patients yesterday that were seriously ill. Both of them were on ventilators, had respiratory failure, survived and actually did well. And both of them walked out of the hospital yesterday, were reunited by their families, and it was a great sight. I know a lot of people were out there yesterday cheering them on and wishing them well. So it was a good day here.
It's good to hear.
Now, Dr. Markson, people really want to help, and especially some of the people who have been diagnosed and had really mild cases of COVID-19 are now getting the chance to, in some way, help out with this whole cause. But whether it be with plasma donations, and we know immunity testing is coming, what is the hospital doing with that right now?
Yeah, right now we're collecting information, or we'd like patients to contact us who have recovered. And there is some thought about collecting their antibodies to be used for immunotherapy for patients who are ill with COVID-19. And you can contact us through our practices.
Has St. Luke's given plasma to someone so far during this health crisis that has seen benefit?
I understand, yes. But, it's whether it's beneficial or not, sometimes all these therapies are a little hard to gauge. We're stuck with anecdotes, and we sometimes really don't know whether someone would have gotten better on their own. It's the same debate we're having still having about hydrochloroquine and other therapies. We have the sense that they help. We certainly see better outcomes, whether it's because we're more experienced with caring for these ill patients or because the therapies themselves. At some point, we're going to look back on this and we'll really know, but we're trying everything we can.
Dr. Goldner, let's talk to you about therapies at the Lehigh Valley Hospital-Pocono. What's going well there for you and your staff?
It's just like Dr. Markson said, it's really unclear yet what really works. Pretty much everybody that is admitted to the hospital is put on hydroxychloroquine. It changes week to week. Last week it was hydroxychloroquine and azithromycin. They found that there were some side effects from azithromycin, so they stopped it. We actually are also starting some trials with Lehigh Valley Health Network with some of the newer things like Dr. Markson mentioned, convalescent plasma, and some of the other newer medicines, some of the HIV antiviral drugs are actually going to be studied as well. But nobody really knows in the United States or even in the world what exactly works yet. And they'll find out. It may take time, 6 months, a year, proper studies. Right now, they just have these small little anecdotal reports of what works and what doesn't, and that's what they're going by.
Dr. Markson, we talked with you a few weeks ago, and wow, it was a really scary time then. We were just launching all of this, and I know so much has happened in such a short time, but what is the climate like at the hospital right now? How have things changed from just 2 weeks ago?
Even within your listening area, it's a little bit of a tale of two cities. So our counterpart hospital near Dr. Goldner's, the Monroe campus of St. Luke's, they're very busy. It's a more New York-oriented population, and there are still plenty of patients in the ICU on ventilators. I think all the docs are getting a little bit better about how to minimize the use of ventilators using prone activity, turning patients on their belly or on their side to try to prevent the need for a ventilator, and even on ventilators trying to maximize lung capacity. In where I practice, in the more western portion of your listening area. We did lots and lots of surge protection, and since in the last 2 weeks, our turnaround time on viral testing is really remarkably changed. Initially, when we last spoke, it was still 6 or 7 days. Now it's 4 or 5 hours till we find out that the person does or does not have COVID. So that's a big change. And in the western portion of the listening area, we're pretty quiet. I like to say that in some ways I think our hospital is safer than going to the grocery store.
Wow.
So it's really a big change. We worry more about patients in our area ignoring their other medical problems.
Understood, yeah. How about beds? Are there still enough beds, balancing both of those places? Are there still enough beds, obviously, in the western area? How about the eastern area? Because we're talking about East Stroudsburg University, Kaler Fieldhouse being set up right now as a possible hospital. And are we going to need that? What's it look like?
My sense is that none of these places will be needed. I don't want to jinx it by saying that, but that's my impression right now. I think we're at the peak, maybe even slightly beyond it, but time will tell, and we can't let down our guard, but looks positive to me.
Okay. Dr. Goldner, as we look back over the past 4 weeks when things really started getting going here with the coronavirus, how has things changed at Lehigh Valley Hospital-Pocono?
Sure, I think things have changed a lot. I think the anticipation of the surge coming through, trying to get our surge capacity up to make sure we had enough beds, ventilators, staffing, was really very much on our minds. We were very, very busy, I want to say about a week ago. And again, just like Dr. Markson, I don't want to jinx us by saying that things look like they're, doing better. They are certainly eased off. I think some of it has to do with us trying to get patients or our ability to get patients through the system a little bit easier. We see patients getting better now. We still have patients coming in with COVID infections, but it seems like we're able to handle it a little bit better. And possibly we're starting to see the amount of cases ease off a little bit.
Dr. Goldner, as far as the beds, and Dr. Markson gave his opinion about the possibility of using ESU as a remote hospital. The Army Corps of Engineers has been doing a great job getting that all set up. What is your feeling as to whether we're really going to need that or not?
Don't really know yet. I'm hoping and praying we don't need it. I think it's good as there that it could be utilized if needed. And at this point, no one really knows what's the future holds. Things change so rapidly with this and occurred so rapidly. I am, just like Dr. Markson, hopeful that things are going to improve. But I think one just doesn't know yet day by day what's happening. So we're looking at all the options, and we're keeping our bed capacity available if needed.
Now, Dr. Markson, we understand that they're setting up a mass testing site here in Northeast Pennsylvania, I believe in Wilkes-Barre, and wondering what your thoughts are on that. Should people from our area be thinking about going out there to be tested?
To be honest, that's news to me, but there's so much changing, even in the way of testing. You hear now about there's going to be new saliva testing, that maybe that's going to be safer for the person testing the patient and maybe more accurate. There's a fair amount of false negatives with the current swab system. So again, like all this information, I think it's changing day to day. To me, what the most interesting thing will be when we have antibody testing, and it's particularly if it's accurate, because that will let lots of people know that they've already had the disease, if we can count on the results.
How far do you think we are away from that?
It's talked about constantly, and particularly in terms of how we are going to roll back some of the restrictions that we've placed on society. But every time we sound like we're getting closer to that, I hear a little creep into the report of the question about the accuracy of these examinations. I have some colleagues at Columbia Presbyterian, for example, who were very excited about their testing, and then spoke about the false negatives, patients they knew had the disease and were coming out negative. So not quite sure what we can count on for it. It might be more useful as we look at our community and know whether our community was broader hit than we thought, but it may not help the individual in knowing what is safe for them to do or not do.
True. So much is changing so quickly that it only makes sense that it takes some time to figure out which tests are working, how well they're working, and know what we can trust. Going back to the beginning of this, one of the biggest, scariest things starting from the beginning was the fact that we had a shortage of equipment for our hospital workers, our people on the front line. Dr. Goldner, is that still happening, or do we still have a shortage of the equipment that our health professionals need to keep themselves safe in the hospitals?
Right now, we're doing okay, and always we're looking at our supply of PPE, as we call it, which is the amount of gowns and face masks and face shields that we have and gloves. We're holding our own. I know we do share things with the other hospitals in our network. So if someone's running a little bit low on something, we are able to obtain it from somebody else. And if we have a plethora of something, we can actually share with the other network hospitals, you know. And so we've been doing okay and getting by. We're always concerned about that. And I think, you hear, these stories in the United States and New York especially about the shortages. So, but we're so far, we're holding our own and doing okay.
Dr. Markson, how about St. Luke's? Same question.
Yeah, we're constantly monitoring the outpouring of community support in coming up with cloth masks that everyone can use is really quite innovative and amazing. And I also want to point out that both hospital networks have really taken on the task of being community health resources. Hospitals are complex organizations. They do lots of things, and right now they're completely thrust into the role of taking care of our broader area. And I think both are doing a tremendous job, and we are quite lucky to have both of these networks as part of our life.
Yeah, I think if you go back a few years ago, we wouldn't have these two strong hospitals here
Absolutely.
in the Poconos, and it could have been a different situation, I guess, if you took us back maybe 10 years. Am I right, Dr. Goldner?
Yeah, I think it's really been a good thing that we're working together and providing the care to the community. It's certainly in a crisis like this, having the capacity of both institutions has really been a good thing.
Dr. Markson, a few weeks ago when we talked to you, we were talking a little bit that was the beginning of social distancing, which we turned into physical distancing. And since then, since all of that started, we've also included the masks in public, which they weren't saying way back then. So how do you think the community is doing with all of that? And is that changing what you're seeing coming through the hospitals?
Yeah, to me, there's a big shift in how people are perceiving it. In the beginning, as we spoke, I had a fair amount of patients, I would say 30%, who were rolling their eyes and thinking this was a big media hoax. And now people are quite scared and really take it seriously. And as I mentioned, I do worry a bit that to the point that they may ignore their other their health that is not COVID related. I'm just going to tell a very brief story of a colleague of mine was telling me his cousin was short of breath, didn't come to the hospital because she didn't have fever, which everyone was talking about. But as it got worse, she finally came, and it turned out she was having a heart attack. So that's the thing I worry about now. People are so scared that they're not attending to their other healthcare needs, and we're capable of, and we want to make sure those needs are taken care of.
Yeah. Good. That's good advice too, and I think people should think about that if they're not feeling well. Dr. Goldner, has a timeline been put together for the average COVID-19 patient that comes to the hospital, like as far as when they start feeling symptoms and how fast they go from feeling good to feeling bad, and then the time they're in the hospital and maybe on a ventilator? Is there any kind of a timeline that's been developed?
I wouldn't say a timeline because it's very variable from person to person. The majority of people who have COVID infections are able to be treated at home. I would say close to 85 to 90% stay at home and do okay. They may have feel like they had a cold. Some symptoms may be very mild. Some people feel like they have a bad cold. It's only the small percentage that need to be hospitalized, and an even smaller percentage that end up on our intensive care unit that would be in the hospital on a ventilator. So those that do end up on a ventilator, it seems to occur more in the week number 2. And then if they are on the ventilator, it usually is a good week or 2 that they're on the ventilator before they get well enough to be able to come off and breathe on their own and be discharged home. So I would say the majority of people, it's not a very prolonged course. It may be a week or so that they're feeling ill, but it could be longer if they are sicker.
Okay, and just as a follow-up then, the people that are home, what are they taking when they're home? Are they given a prescription for something, or are they taking over-the-counter medication just to feel better?
If they were started on the hydroxychloroquine in the hospital, they would complete that course at home. Sometimes they complete it if they're in the hospital, actually. Most patients at home actually are not really taking any medications other than symptom medicines, maybe some Tylenol for the aches and pains or decongestant, something like that. So again, we still aren't 100% sure what really works for this virus and what doesn't.
Dr. Markson, we know we've been listening to the governor every day and to the national press conferences as well, talking about getting some people back to work. Now we're at the end of this month, a decision is going to be made. We're under that stay-at-home order until the end of this month. And do you foresee, or do you think it's a good idea that we start getting people to work, or is it too soon?
You know, those are big, broad questions. I certainly understand that we have to balance the community needs, and the community needs are, we can't completely ignore the economics as long as we don't do that recklessly. I certainly envision that there's going to be a phased reintegration to society, and I won't be surprised if it doesn't start in some manner next month. The good news is at this point that people have really accepted the use of masks and physical distancing. And if that trigger is too soon and it has to be, many people say, let's not let this happen in case we have to do it again. I think people will be more accepting of that if that happens. Everyone wants to, there's the spring, everyone wants to be outside and with each other. We have to try to prevent too much of it, but I'm looking for cues from levels above me, but
absolutely.
But I think it's reasonable.
Now, one of the things that they've said about this virus is 77 degrees, and once it warms up here, that maybe nature will take its course and the virus won't be able to live on surfaces or live here. Is that, Dr. Goldner, is that something you think is possible, that it's going to kind of burn itself out as to being so dangerous?
I haven't heard the 77-degree limit, though, but I think generally if you look at most illnesses, as the weather gets warmer, they seem to decrease, such as influenza. We do know, though, that if we stop these mitigation things that we're doing, such as staying in, wearing masks, the social/physical distancing, if we give up on those too soon, it will be back, and we will have a second surge. So it's still, I can't emphasize it enough to people that despite it getting warm, despite we all wanting to get out there and and mingle with people we miss very much, they really need to avoid doing that for now.
Do you think that, Dr. Markson, do you think that moving ahead now, masks are going to become sort of the norm? We're going to be around people that maybe for the next year or two, people are going to be wearing masks, or they should be wearing masks?
That's hard for me to say. I will say that it's striking that in Asia, that the outbreak, even though it started there, did not really seem to be that profound as it is here. And they have a culture of wearing masks frequently, even for high pollution days or the flu or other illnesses. And maybe that's a big reason why it didn't really catch on in the same way. Mm-hmm. So I assume it's going to be a stronger part of our culture.
You do. Dr. Goldner, what do you think? Masks moving forward? How can you go to a concert with 50,000 people and not wear a mask?
Yeah, or a movie theater. I agree with you totally, George. I think our new norm has changed. I don't think we'll get anywhere near back to normal unless there's, until there's some type of vaccine for this virus. Then I think things might kind of get there. But masks will be what people will be wearing when they go out to the store, when they're close together. They'll be even at family gatherings, without a doubt.
Dr. Markson, do you think this whole health emergency has launched a whole new way in cleaning and disinfecting hospitals? Has it changed a lot since all of this happened? It seems to us on our side that this has changed a lot. But I don't know, from your perspective in the hospital, has it changed a lot, or is this what you've been doing? And if it has changed a lot, are we going to stay that way?
Human habits are tough to create, and then they're tough to break. So I assume we're going to be better at it. We have a terrific infection control person at our hospital who was, I would say, almost haranguing us about our hand hygiene percentages and calculating how much was left in the bottle and therefore how much could have been used. And all of a sudden, we're all at 100% instead of 70% without him reminding us. So certainly, lots of things have changed. Whether we keep this habit, time will tell.
Yeah. Dr. Goldner, let's talk about food safety, because one of the things that people are doing, of course, is grocery shopping, or they're going and getting takeout, or they're having delivery to their house. So somebody is touching food somewhere along the way, and it's making it to your home. Now, what are some of the things that people need to think about with, like, for example, fruits and vegetables? They've been handled probably several times before they get to you. Even in the store, somebody might pick one up, look at it, put it back because they don't like the way it looks, and they move on to another piece of fruit or something, right? So when we get that home, I've heard different things about washing vegetables, and I guess at some point, it's not going to live on that forever either. But if you're going to eat it right away, I guess you have to. What would be the procedure you would recommend taking care of fruits and vegetables?
Yeah, I have to agree with you. I think we all have to be very cautious now. Things could have been handled by somebody, so it's very important if you're able to, is wash whatever you're getting. It could be touched by numerous people. Could someone have had COVID? We don't know how long COVID virus lives on different surfaces. We think it lives on certain things longer than others. It may be even sometimes days. So I think somebody has to be, or who's going to buy something has to be very careful. Buying something that you're going to eat right away, I would just be cautious that whoever's been handling that is wearing gloves. And before I would, make sure that I would eat something personally. But I think if you're buying something in the supermarket, wash it. I think that's a good thing to do.
Right. Now, here's another issue. Dr. Markson, we're talking about like food from a restaurant, a takeout or something like that. They have several workers there. We don't know all the precautions that some of these restaurants are taking. I don't think there's anything that's, written anywhere that they have to be testing their employees and things like that. But you're having people handling the food at those locations. You don't know what's going on there. You may trust the place because you've eaten there before, but you still don't know. And I guess, is it safe to be, to watch where you go and buy this food? I know we want to keep the economy going, but at what point, do you decide whether or not you want to get takeout food?
I think it's like anything else in life, and this has elevated this issue about food, but it goes back to using vendors that you know and trust. And I think that's the best you can do. And you still have to wash things. The places I go to make a big fuss about how they're delivering it, touchless, put it right into your trunk without interacting with them directly, paying ahead of time so the credit card is not getting. Whether all these things matter, theoretically they do, or hypothetically they do, but we really don't know. Just because a viral particle is alive on it doesn't necessarily mean you're going to get the infection. So you try to use common sense, try to wash, and try to go to places that you know.
All right. Dr. Goldner, we talked a little bit earlier about the fact that we definitely don't want people to ignore other problems, non-COVID related. Both of you talked a little bit about that. But on that same vein, we know that right now all of the elective procedures aren't going on. Is there any talk about when those things, which some of those elective procedures are going to prevent something drastic from happening, when are those things going to start coming back?
Sure. Another great question. We're actually starting to look at that as an organization. When do we start doing some of the surgeries that are, we'll start with the more urgent ones and then sort of go down into the elective ones. But we're having these conversations now because we're preparing for what's going to be happening in the next several weeks. That, again, these type of surgeries will be allowed in the hospital.
All right, yeah. Dr. Markson, same thing. Is St. Luke's looking at relaunching a little bit of that, or the more drastic ones anyway?
Yeah, well, drastic ones, urgent surgeries have been occurring all along. Some of these issues are also mandated by the State Department of Health, and certain kinds of centers really can't open right now. So we're looking for cues from the state, and also we're having internal discussions.
All right. So moving forward, this has been a couple weeks since all of this happened. Wow, great, crazy time. We never thought we would talk with you guys so often about such important, quickly changing topics. But we do thank both of you, Dr. Jonathan Goldner and Dr. William Markson, for joining us today.
Yes, thank you so much, gentlemen. We really appreciate it. And don't forget, everyone, for the latest local coronavirus news, watch News 13's Pocono Valley and Night Reports right here on BRC 13. Thank you.